and welcome to Wellness Series with Lush, a platform that gets us in touch with our well-being. We have been consumed with a lot of information concerning the COVID-19 pandemic. One such is getting our immunity much more stronger. We've talked about fitness, we've talked about eating right, but one element that we still need to create awareness on is how do we manage getting over-counter drugs in managing and boosting our immunity. To help us discuss on how to be responsible in acquiring over-counter drugs, I have Mr. Makhosi Sibanda, who is an expert in the pharmacology industry. Good afternoon, Mr. Makhosi. How are you?
Well, thank you, and hello to your viewers, and thank you for having me.
Thank you for being here. Mr. Makhosi, every corner we go to, it's COVID-19. And parallel to that is how do we get our immunity stronger? We know that we need to keep fit, we need to eat right. But one quicker way, as per perceptions out there from the community, is getting drugs. Can you just take us through that? How do we do it right? How does a viewer at home know what to take, what not to take, and when to take it?
Look, like you said in your intro, Corona is spreading very fast.
Yeah.
And it's all over the media, as we see. And what the viewer then sees is people dying around them, and they all get into a panic. So they then think about themselves and say, what should I do to prevent myself from catching it, or if I catch it, to not catch the severe strain of the disease itself.
Yeah.
So they then rush to the pharmacy and see what they can buy. They Google on the internet what they can buy. There's all sorts of discussions of medicines, some approved, some unapproved, and they get curious. So the consumer then goes to the pharmacy to try and see if they can self-diagnose or self-prescribe, and then take medicines for that.
Yeah.
So that is a twofold effect, where they're diagnosing illnesses or symptoms on their own, and they may misdiagnose themselves. It may not be COVID-19, or they may treat themselves as the wrong thing because they've read about it somewhere or heard about it from a friend or a relative or simply on social media.
Yes. So how do we then approach that? Because we know that especially, I'll keep emphasizing with the over-counter drugs, that I can just go to Mr. Makhosi and say, can I have an X? Because I Googled it, and chances are it will be given to me. How can, from a consumer's point of view, how can we be responsible in knowing what to get, when to get it, and how?
Okay, I think maybe I can start by saying currently there is no known cure for COVID-19.
Yeah.
So there is a vaccine that has been approved by WHO and US FDA, and probably we will get some of those vaccines in the next couple of weeks or months into Botswana.
Yes.
So what is currently available then is are supplements which are available to strengthen the immune system. I don't want to call them immune boosters because all you can do is really strengthen the soldiers you've got in your body. So there are some recommended supplements, which are your vitamin C, vitamin D, some zinc, vitamin B complex, and these used in the right doses are available over the counter, and patients or people can take them either before they get COVID-19 or when they start getting the mild symptoms, just to supplement and strengthen the immune system. So that's what's available, and responsible use of these is what we're advocating for. And as a general rule of thumb, self-medication is not recommended. So whatever medicine you take, consult your health professional, such as your doctor or your pharmacist. And then they can recommend what you need to take, especially when you are then confirmed that you're COVID-19 positive. You do need to be in constant touch with your medical practitioner.
And not just put your belief on what you see on the digital space.
Exactly. So there's so much information available, and a lot of it hasn't been tested. So just for your safety, only stick to what has been tested and approved. We've got BOMRA locally, which approves medicines. There are some medicines which are approved on a patient basis. They still have to go to BOMRA via your doctor. So we urge patients or consumers not to self-medicate, self-diagnose, self-treat, and there are all sorts of categories of those products which may lead us to the bigger problem than we currently have right now.
Yeah. And follow the instructions as they are. You mentioned earlier on that proper dosing of these supplements is equally critical. It's important. Let's just give our viewers a bit of shock therapy, because one might be sitting, look man, it's over the counter, I can take as much vitamin C as I want, or whatever supplement that can be recommended to help the soldiers or your immunity. What's the worst case scenario if you don't follow the dosing guidelines?
Worst case scenario is, for instance, you don't have COVID-19. You're just taking a supplement like vitamin D just to strengthen your immune system.
Yeah.
Vitamin D in high doses is very toxic. So it leads to all sorts of complications within the human body. Vitamin A, for instance, also quite toxic in high doses. So all those you still need to take as per recommended doses. And people tend to believe that if you take something in a higher dose, you then strengthen your immune system.
That's
faster.
how you really make it work.
Yeah. so if it's really in a very high dose, some really are water soluble, like the vitamin C to wash through, but still anything more than a certain recommended dosage is still useless within the body and not recommended again. What also happens with self-medication, it doesn't only end with over-the-counter drugs. People have antibiotics left over at home from maybe a previous condition.
Or they got it from a relative or a friend.
Exactly.
Like, this worked for me. Yeah.
That's the thing. And once they start taking those, it might not be a full course. It might be the wrong antibiotic for the wrong condition. And that leads to a bigger problem of antibiotic resistance, for instance. So self-medication, in a lot of ways, is not the best way. There's another implication. For instance, some of the drugs I won't mention by name because we don't want to hype them up. The audience may then look them up and also start stocking them up. I'll just tell you what they're used for. For instance, for anti-malarials. If you then abuse those, they've got certain effects on the heart or on your breathing, some of them, which is what you're trying to prevent. You got animal health medicines, which are also busy being discussed on social media for use for the treatment of COVID-19 or prevention. And these are not tested medicines. So they may help one or two people, but in some people they may be very, very harmful. So it's not for us then as lay people, if I'm talking from a patient's perspective, to take that risk and gamble onto what is good for me, what's not. Just let your doctor manage you if you've got COVID-19. If you don't have it, in terms of prevention, just take the recommended supplements, which are your vitamins C, vitamin D, vitamin B complex, and zinc. Stick to those ones that are tried and tested, and they work for your common cold. They also work for COVID-19. Anything else, if you start having headaches or pain or fever, paracetamol is still the recommended one. Don't self-medicate on other stronger painkillers, which you probably have from another condition, like again arthritis and so on, maybe NSAIDs. They also may cause complication as a patient, and they've led to fatalities. So they are not used, or use has not been proven. So there's lots we don't know about COVID-19. So rather stick to your doctor's advice, stick to being under the care of a healthcare professional, phone your pharmacist, be in constant contact, especially once you've been diagnosed. So it's quite critical that you do.
And in closing, I guess we can say it's okay to empower yourself to research on what is available out there, but it's critical, like Mr. Makhosi is saying, to seek medical verification of that from your doctor, from your pharmacist, before you can self-medicate. And from whatever that is left over, I think maybe in closing we need to do that, because to discuss this, because it's equally important. Saving of medication, and then later on I can say, no, take this, it worked for me. What do we do with leftover because I think it's wrong in the first place if you don't finish your antibiotic course. But let's just say it's there and you got well. How can it be disposed of so that we kind of kill away the interest or the like or that one might have to self-medicate?
Okay, I'll start by saying antibiotics for a viral infection aren't recommended. They may be used for COVID-19 under the care of a doctor. So self-medicating with antibiotics is totally wrong.
No-no.
It's a big no-no. So do not self-medicate with an antibiotic. And always when you have an antibiotic course, finish the course.
Yeah.
If you do have some left over, discard them in a safe manner. Either take them back to your pharmacist, who know how to incinerate them and so on. So you should not have really leftover antibiotics at home. You should not keep antibiotics at home for a rainy day. Those should be only prescribed as and when they are required, so that you do not find yourself then with antibiotics in your medicine cabinet, which you then think they're the right ones for COVID. Yeah. There are specific ones that are used in a concoction of medicines to manage the hospitalized or critically ill COVID-19 patients. But those are not used for prevention, because again, like we said in the beginning, they can lead to a bigger problem, so that when you do require it, when you are in hospital or in all sorts of positions, it will work for you. Yeah. If you've got resistance, it will not work for you when you need it.
Yeah.
So self-medication on antibiotics, definitely a big no-no. On other animal health products, also a big no-no, because they have not yet been
tested in humans.
Yes.
Yeah.
So people may come with testimonies of having success in 1 or 2 patients, but that's 1 or 2 which perhaps were progressing well and were never going to need any treatment. Yeah. So there's a lot we don't know. You know, picture this. I mean, if you see the statistics, 1 in 2 perhaps will get better by themselves, and others will need treatment in the form of medicine and so on, or hospitalizations for even the fewer ones. And we treat everybody with the same concoction. I think we're creating a recipe for disaster, as well as a big shortage perhaps for those that critically need some of these medicines.
Who might need it.
People are hoarding at home in the case that they need.
Yeah. Wow. This has been quite insightful, and it has enlightened me, because I've had stories of people who've always thought, you know what, I can have whatever I want to have. And I hope that after today, people now have an idea that it's always important and very, very critical to seek medical advice or verification of whatever you might have read from a medical personnel, your doctor, your specialist, or even your pharmacist as well. Thank you very much for joining us, Mr. Makhosi.
It's been a pleasure. Thank you.
Wow, and that's what we had today. I hope that you've been inspired to well up and own your well-being. Thank you. See you again next time.